Welcome back to the Wellness Check, a place to check your wellness, to learn tips and tricks for a sound mind, a strong heart, and a healing soul. My name is Katie Porter. I've been a licensed therapist for over 10 years, and today I wanted to take a moment to talk to you about higher levels of care for treatment of eating disorders. My last video was about the lesser known eating disorders or disordered eating. And today I wanted to share advice or recommendations for if anyone that you might know is going through an eating disorder or might have signs or symptoms of what to do in terms of intervention and care. So, what I do, I'm a therapist, and this is my office. And this is what's considered outpatient therapy. So this is where people come in once or twice a week for an hour. We talk about the things that are going on, where are you improving, what is feeling better, and where are the challenges or the pressure points, and how can we come together to support one another and move forward to the next goal that you have. So typically what the trajectory looks like for outpatient therapy is, like I said, once a week is pretty normal, pretty average. If someone's going through something, they might need to call me and say, hey, Katie, I need to come in for a second appointment, which is totally fine and normal. They're meeting their therapeutic goals. So now we can start looking at every other week or every 3 weeks. And then we move to what's called maintenance sessions or check-in sessions, where they might come in once a month and they're living a lot more of their life weeks at a time without coming to therapy, and their stability is really increasing and they're able to solve problems easier, and they come in just every once in a while for a check-in. This is what outpatient therapy is, and it's a beautiful thing. When it comes to especially eating disorders, outpatient therapy sometimes is not enough, and we need to go to a different level of care, something that's higher than outpatient in terms of therapy. So I'm going to share with you guys the next levels up, and we're going to go from all the way from the bottom tier to the top tier, and we can talk about facilities that are around the nation. We can talk about all the insurance and the assessments involved and all of that, in case you're feeling really lost. And this is something I educate all my families and clients on, should we need to take that step. So above outpatient counseling, which is what this is, what you typically think of as therapy, is something called IOP, and that means intensive outpatient therapy. All right. So in IOP, what's typical is the individual will go to an eating disorder facility, and they will program, which really means they'll be doing more intensive therapy for maybe 3 to 4 days a week for about 3 or 4 hours at a time. So what to expect in IOP is you go to a facility, an eating disorder facility, where there are doctors who do the medication management portion. You have your individual therapy, you do your group therapy, you do family therapy, and a lot of times as well, there's meal support there. So you'll be able to eat a meal with the milieu, with the group that you're with, and be able to process thoughts and feelings around mealtime itself and anything that comes with an eating disorder. So any body image distress, food challenges, adding variety or adding overall intake to one's daily diet, right? So that's IOP. And typically with IOP, you can also keep your outpatient therapist, which is really nice. It adds some familiarity and also gets you a different environment. So if I have clients that are in IOP, they'll do their 3 to 4 days a week for 3 to 4 hours at a time. And they can also come and see me once a week as well, or whoever their outpatient therapist is. And we can talk about their IOP experience, what's working, where are they really pushing you and challenging you, and it feels really familiar and nice. The next stage up from IOP, in case someone needs more support, they are let me tell you why they might need more support. If they're an IOP, but then they go home or they're going back to school or whatever the case is, and they're still really engaging in eating disorder behaviors at home, maybe there's binging or purging going on, maybe there's active restriction or refusal to follow the recommendations of their team, maybe they're engaging in self-harm or just really emotionally dysregulated, then we look at the higher level from IOP. And the acronym for that is PHP, and that stands for Partial Hospitalization Program. So with PHP, what's typical is you go to this facility again, and you program for about 10 to 12 hours a day, usually 7 days a week. So you're there all day. You get to have your meals here. You get to have your therapy here. It's more intensive in terms of what types of therapy you're getting into and how deep you can go into these therapies. So with PHP, you're there for the bulk of the day, and then you get to go home to your family and sleep and then come back and program. If you're a student, you also typically get to have cut out time in the day for programming and do homework. And at some sites as well, there are certified teachers there to help instruct you or give you tutoring or help you work through your assignments so you're not falling too far behind in school. Another option for a student in PHP is to temporarily withdraw. So if you withdraw from school, then you can really focus on the PHP itself, get all of that treatment team support that you need, and it's really pretty intensive. There are 2 more levels above PHP. So why would someone need anything above? Let's say that someone is programming and they're doing their 10 to 12 hours a day, 7 days a week. But then when they go home, once again, they're getting really dysregulated and they're not able to use the tools that they are learning in programming. Maybe they're engaging in eating disorder behaviors or their thoughts are just too big to manage and cope with on their own. Then we look at what's above PHP, and that's called residential treatment. So someone that's in residential treatment is living at this facility. And instead of programming all day or for a short amount of time during the day, they sleep there and they program. They sleep there and they program. And this could be anywhere from ideally 3 to 6 months, ideally, and we'll get into the little asterisk that I'm putting there with all the insurance, but ideally that's what we want to see is enough time for them to be separated from maybe their stressors at home or at school and to really be able to have that 24/7 team support around them to help them with their recovery. Typically at residential treatment centers for eating disorders, you're getting all of the same things that you would at IOP or PHP, but just more intensively. There tends to be more trauma work done. You can get even deeper into the therapeutic goals and interventions there. And they also offer things like trauma-informed yoga therapy, equine therapy, all sorts of really amazing opportunities to learn about one's self and challenge in all areas of life and not just condensing it to food and body. Okay. All right. So there is one more above residential, and this is the tippity top. This is the most support that one can find in the treatment of eating disorders, and it's called inpatient. And someone that goes to inpatient is medically unstable. So due to malnourishment or due to medical consequences of the eating disorder behaviors themselves, their labs are really off. When they get blood work done, it's not looking good. We're looking at cardiac issues. We're looking at overall medical and mental health well-being not being stable enough for any of those other levels of care. We need actual, like a hospital-based med-surg program. And there's one that I know of in the United States that is really what you might consider the caliber of inpatient treatment specific for eating disorders. And so there, I mean, you're looking at the probability of an NG tube, so tube feeding to get nourishment in. Typically, the individual is very fearful and refusing of treatment, even though their medical health is extremely compromised. So the whole point of inpatient is to get them stable, to get them nourished enough where their vitals and their lab work is becoming more stable to where then they can step down into residential. So if you think about it as inpatient is maybe more of a crisis situation, this individual is not safe. We need to get them nourished. We need to get their body in a stable condition before we can even think about doing therapy at that point. So these are the tiers, right? From the bottom to the top, we have outpatient therapy, which is what I do, which is what most people consider therapy. Then we have IOP, then we have PHP, then we have residential, then we have inpatient. So typically, also something good to know is if you start at any of those higher levels of care, it's recommended to step down according to that step plan as well. So if someone goes into PHP, you typically don't want to see them come right back to outpatient therapy. That's a really big adjustment for someone, and they tend to maybe relapse because it's going from a pretty intensive thing down to outpatient. So you want to go from PHP down to IOP, let them settle there and try life more at their own pace, come back to therapy, and then step back down to outpatient. So I hope that this is helpful in understanding what is an appropriate level of care for someone that's going through an eating disorder or has disordered eating, and how to help. There are many, many, many places around the United States that offer all levels of care, or some of them specialize in residential, some of them specialize in anorexia versus binge eating. They have different types of programs and specialties. So if you're looking at even just beginning to research what's available, start your search by what is the presenting issue? Are we looking at more of a restricting type disorder? Are we looking at more of a binge eating type disorder? What is it that we're looking for? And find the treatment facilities that specialize in those. And then we want to look for the levels of care. The first step is to give the facility a call and say, hey, I myself or my daughter or my son or my niece or my nephew, whatever it is going through this. I was wondering if we could set up an evaluation to determine what level of care she needs. And they will take it from there. They're very good at doing their assessments. They will ask you lots of questions, or the person with the disorder themselves, lots of questions about behaviors and thoughts and body consciousness and relationship with food, and they will be able to determine what level of care they need. They will also pre-authorize your insurance for you and let you know what all of the benefits are. So most places take commercial insurance, most of them. There are some that are private, but not always. So you want to be able to get all of the insurance information laid out. That way you'll know maybe how many days are going to be covered, right? Insurance is going to say, I'm going to cover 6 weeks of this. This is what we need to see in order to approve it, or if we need to bump him or her up or him or her down a level of care, this is what we need to see. And then after the evaluation, the assessment, the pre-authorization of insurance, then we schedule a date. You schedule a date with the facility and say, this is going to be the day that you guys come in, and we will program. So they try to make it as easy as possible for families. They know that this is a very scary thing to do, a big decision to make as a family, and they answer all the questions. They want to support you as much as they can. They are on your side. So just look for the reputation of the treatment center. You want to look at reviews. You want to look at all of that to make sure that you're going to a reputable place, and ask all of the questions. Ask all of the questions of what to expect, et cetera, et cetera. With COVID, a lot of things have even moved virtually. So there are options for IOP, especially to be virtual. Family therapies. So if you're going to a treatment facility, maybe in Georgia and you live in Texas, you wouldn't have to fly out there every couple of weeks. You could do a virtual family session as well. And I think that that is really a convenient thing to do. So that is my spiel for treatments, for levels of care, support, and education for those that are going through body image issues, discomfort with relationship with food, whether it's disordered eating or eating disorder itself. It's important to know that early intervention is key. We don't want to wait until we get into a crisis to intervene therapeutically or medically. A lot of research shows that the earlier the intervention, the better the outcome, not just in that moment, but lifelong. So maybe my next video will be early warning signs and symptomology of if we know someone might be going through an eating disorder or have disordered eating or a disturbance within that relationship. That way you can really kind of keep an eye out and know what it is that you are seeing, and now you know how to intervene. I hope that this has been informative for you. It can be very scary, like I said, to navigate this on your own as a family. So I just wanted to spread the word on what this looks like, how to do it, and make it as easy as possible for you guys to make that decision. Thank you for coming in today. Thank you for checking in with your wellness. Have a great day, and I'll see you soon.